Hello and welcome to our webinar, Food Safety Documentation for Small Food Manufacturers. I'm Angela Gardner, a Program Associate with the University of Arkansas System Division of Agriculture. We would like to start out this webinar with two poll questions to understand our audience today. So the first question asks, please select one from the following. Are you a farmer, food business owner or producer, a food facility manager, a food business employee, a regulatory specialist, an extension employee, or something that is not included in that? And secondly, do you have a food product? Yes, or do you make a food product? Excuse me. Yes, no, I do not currently, but will in the future. If you could just take a few seconds to answer those two questions for us. This meeting is being recorded and it will be posted on our website. And I will drop the link to that in the chat here in a few minutes. And if you have any questions, please place those in the Q&A box at the bottom of your screen. So the results for today, we have one farmer, two food business owners, a couple of extension employees, and we have 3 people making a product and 4 who are not, and 1 currently thinking of that. So great. Thank you so much for joining us today. Again, I'm Angela Gardner with the University of Arkansas System Division of Agriculture, and I'm joined today by our guest speaker from Cornell University, Dr. Abby Snyder. Abby, if you could introduce yourself.
Thanks. I'm Abby. I'm an assistant professor of microbial food safety at Cornell University in the food science department. My work is with small food businesses to facilitate regulatory compliance and the development of documentation systems.
Thanks again for joining. Also with us today are 2 state experts in food safety and food science. Dr. Amanda Perez, if you could start off the introductions.
Good afternoon, everyone. Thank you for joining us today, and thank you, Abby, for sharing your information with us. I'm glad to be here. I'm an assistant professor with the University of Arkansas System Division of Agriculture. I work through the Extension Service, working in produce safety and with value-added food production through our Share Grounds program. So thank you all for joining me today.
We are also joined by Dr. Ruben Morwicki with the Food Science Department at the University of Arkansas. Dr. Morwicki.
Good afternoon, everyone. My name is Ruben Morwicki. I'm an associate professor in the Food Science Department in the bioprocessing area and food safety. And I work as a process authority for acidified and low acid foods, and also help people with their, or small companies with their food safety questions.
Thank you again all for joining us today. Again, if you have any questions throughout our presentation, please use the Q&A box located below. So I will start off today by just providing a few introductory definitions for the topic we're going to cover more in depth in Dr. Snyder's presentation. Okay, I'm pulling that up. So when we're talking about small food manufacturing businesses, it's a highly regulated business to be involved with. And so there are 2 big types of regulations that affect food businesses. There are state level regulations and federal level regulations. At the state level, we have cottage food law for our low risk food items that can be made in the home. And we also have manufactured foods regulations for our more riskier products. And at the state level, the Arkansas Department of Health creates these regulations and monitors for their enforcement. At the federal level, food manufacturing is covered under 21 CFR Part 117. And in that federal documentation, it goes over food manufacturing practices, or GMPs, for the food industry, as well as the FDA Food Safety Modernization Act regarding preventative controls for human food. And Dr. Snyder will discuss more about the federal 21 CFR in her talk today. So cottage food law, these are products that are allowed to be made in a home kitchen. And these are low risk food items such as baked goods, other bakery items that do not require time or temperature control to be sold, such as refrigeration. And these products are sold directly to the consumer at the point of sale. So beyond cottage foods, we go into the realm of manufactured foods. And these food items have to be produced in a permitted facility by the Department of Health. And then the product itself, the recipe needs to be vetted, the process needs to be vetted, and needs to be permitted by the Department of Health for manufactured wholesale food manufacturing. And these products can be sold at grocery stores, such as pickles, salsas, sauces, any shelf-stable product, refrigerated foods, and frozen foods. So with manufactured foods, you increase the variety of foods that your company can produce. Now, if you are making an acidified or a low acid food item, so low acid being canned green beans with no vinegar or acidifier added to it, this will require additional verification from our state process authority to ensure that food safety standards are achieved with the recipe and process that you are using. So good manufacturing practices are important for any food manufacturing facility, but for our large-scale operations, they really have to understand a foundation for food safety and how to implement GMPs in their operation. So that includes health and hygiene of personnel, the design, construction, and maintenance of the facilities they're producing in, how sanitation is maintained and controlled in those facilities. And for the food businesses that are making low acid or acidified foods, such as pickles, there are additional GMPs that need to be considered and rolled into your food business operation. And this can be found in Part 113 and Part 114 of 21 CFR. And the FDA has rolled out the Food Safety Modernization Act in 2011, and that just dives deeper into preventative controls and ways that we can prevent the microbial contamination of our food products. And so that includes a hazard analysis of the recipe and the production line, and having steps to reduce any risks that could occur in your operation. Record keeping is the way that these practices are standardized and monitored for efficiency. And with our small food businesses, this can be a barrier. So there are also exemptions for qualified facilities. And Dr. Schneider will talk more about those in her presentation. So that was a lot, and we were just at the definitions. So please know that we are here to help you. Our webpage, www.uaex.edu/localfoods. If you need to find us or if you want to refer back to this webinar, it'll be located at that page. My contact information is available here. And with that, I will pass it on to Dr. Abby Snyder to talk through what the rules are and the documentation we need to think about with our food business operations.
Thanks, Angela. That was a perfect introduction. So I'm moving into my talk. I'm going to be focusing on how the preventive controls for human foods rule of FSMA, and again, FSMA is an acronym for the Food Safety Modernization Act. Don't worry about getting hung up on all the acronyms associated with food safety yet. I'm going to be talking about how that stuff applies to small food businesses. And by small, what I generally mean here is a business that makes less than $1 million a year in food, because according to this preventive controls for human foods rule of FSMA, that's the point at which small food businesses are eligible for qualified exemptions from the rule. And note I said qualified exemptions. So even very small food businesses aren't exempt from every aspect of the rule. But in this webinar, I'm going to be talking briefly about what small food businesses are still subject to, how they can comply with what they're still subject to, and the development of documentation to support both the exemptions and their compliance with those remaining aspects of the rule. So this webinar is part of a training series supported in part by the USDA. And we've integrated additionally just a couple of comments on COVID-19 preparedness into this as well. And you can kind of think of some of those as enhanced GMPs, or those enhanced good manufacturing practices that Angela kind of outlined for us here. So there are a few reasons we've integrated these topics. The pandemic has been very disruptive to the food system kind of generally, and things like recalls or food safety violations require additional attention on an already stressed system of processors and regulators. Additionally, a lot of the practices that align with FSMA compliance, especially for small food businesses where the emphasis is really on GMPs, things like sanitation and employee health and hygiene, those things are also methods for controlling the spread of coronavirus within food facilities. So it's a bit like killing two birds with one stone in some ways. And finally, with these kind of disruptions in consumer purchasing habits, a lot of food businesses are considering ways of modifying their production and distribution of products. So, restaurants are thinking about selling bottled salad dressings. Different farmers are interested in considering extensions and value-added products. So a goal of facilitating FSMA compliance too is actually in support of business development as well as food safety. There's a variety of regulations. Angela touched on it, right? A food processor is potentially subject to. I'm going to be focused on this preventive controls, or PC rule for short, of FSMA, but I'm going to talk briefly too about how other regulations potentially kind of intersect with that rule. And whenever I do a class like this, I tend to get a lot of questions from people about if what they do specifically is covered under that rule. So a bit of a conversation up front related to regulations is kind of useful in setting that stage. And it's also an opportunity, I think, to go through some additional resources and talk about why these different regulations exist, which kind of opens up a discussion about different food safety hazards and risk reduction approaches. Okay, so who regulates food? So the FDA and USDA both regulate different types of food products. Notably, the USDA regulations pertain to meat and poultry. Most food, though, falls under FDA's jurisdiction, and they have specific federal regulations for seafood, HACCP, for juice HACCP, and for canned foods, both acidified and low acid canned foods that were mentioned in the introduction. This PC rule that we're focusing on in this talk applies to FDA regulated products. But the folks that you might most often see in your facility are state inspectors who might even be performing inspections on behalf of the FDA. Some states also have different versions of cottage food laws, which were alluded to as well. And so these are state level regulations. There is not a federal cottage food law. And I bring it up because sometimes when we're talking about small food businesses, people who produce under these so-called cottage food rules will ask if this PC rule applies to them since they are small food businesses. And the answer is no, probably not. And so we'll get into some specifics about how you would know if you're a food business that's under and eligible for these qualified exemptions and what you're still subject to. But if you are simply a cottage food producer who doesn't receive a license for food production, you probably aren't subject to the full or even the modified requirements of that PC rule of FSMA. If you produce out of a commercial operation or even a shared use space or kind of an incubator, they go by different names, then you might need to consider whether your size exempts you from some aspects of that PC rule. I also want to mention wineries and breweries here too, if you or someone you know falls into that category. So those guys produce a relatively low risk product from a microbial food safety perspective, but you are still subject to those current good manufacturing practices or GMP subpart of that preventive controls rule of FSMA. So when we get to the CGMPs and the provisions for providing documentation for employee training, that will still apply to you. But as a note, you don't need to do the part that we're going to talk about regarding qualified facility attestation form completion, because regardless of size, you're going to be exempt from the most labor intensive, most document requiring portions of this rule just by virtue of what you produce. That is, unless you also produce another value added product at your facility besides, say, beer and wine. So jams or soft drinks, for example, then that would put you back under the PC rule and require you to submit that qualified facility attestation form that we're going to go through here. Okay, if you find this confusing, you are not alone. And so what I find is helpful for people is just to go through a couple scenarios and discuss how it kind of changes the regulations under different hypothetical scenarios. So for practice, let's say you're a pickle maker. What regulations are you subject to? Are you a cottage food producer? So no, right? Acidified canned foods like pickles are not cottage foods. The processor here would be operating out of a commercial space or shared use kitchen. and not their home. And so additionally, I'll just note that as was mentioned before, this acidified food category also requires special process review to ensure safety. And we're again fortunate to have your state process authority here who can provide those reviews, participating as part of this course for questions at the end. There's a whole additional regulation for acidified foods that you are subject to, but that does not exempt you from the PC rule. So if you are this person, if you are producing an acidified canned food, you're going to be subject to both the acidified foods rule and that PC rule that I'm talking about. And I bring it up because acidified foods are often popular among small food businesses. They're shelf stable, they don't require a cold chain. These are just for definition, acidified food products are typically ones where a low acid ingredient, like say a cucumber, is combined with a high acid ingredient, like say vinegar. And they're very common among small food businesses. And so I bring that up as a particular example here. So again, this processor would be subject to both acidified foods and preventive controls. All right, here's a second example. Let's say you make cookies. Are these cottage foods? The answer is maybe. If you are producing out of your home and you comply with the other aspects of that rule, again, I'm going to kick questions about the cottage food rule over to your in-state experts at the end here. But if you are making cookies at home, you could be a cottage food producer in that case and not subject to the PC rule. But if you are making cookies out of a commercially licensed facility, like a shared use kitchen or your own facility, then you are going to be subject to that PC rule of FSMA. How much of the PC rule you're subject to will depend on your business size. And we'll talk about the ins and outs of calculating business size and how we measure that later in the seminar. But the number, again, to remember is $1 million a year in product produced as kind of a rule of thumb there in terms of how much you're really subject to. Okay, so different food safety regulations exist for a variety of different reasons, even though it oftentimes stresses processors out that there's so many different regulations that are out there. But typically they exist to mitigate risk based on a few different potential factors. So some regulations are based on the types of products produced, like the juice or the seafood HACCP regulation, which are commodity specific. Some regulations are going to be based on kind of the packaging or distribution system for the product, such as the low acid canned foods rule or the acidified canned foods rule, and reduced oxygen packaging rules, especially at the retail or food service level. Some regulations exist to protect certain sensitive consumer groups, like regulations on infant formula or foods. But we are going to be focusing again on that PC rule of FSMA, which is a general regulation across product categories. But despite that kind of generality, there are certain size-specific qualified exemptions. And in this case, a facility is eligible for those if it produces less than $1 million of product each year on average. What is the PC rule of FSMA that I have mentioned like 100 times already in the presentation? So FSMA, Food Safety Modernization Act, includes several different rules. You might have previously heard of the Produce Safety Rule if you're a grower of fresh fruits and vegetables. The Preventive Controls for Human Foods Rule covers food processing. And in that rule, which I sometimes have been calling the PC rule for short, there are 7 different subparts here. I show them on the slide A through G. So if you sell more than $1 million, you're subject to all of these subparts, and you have to additionally take this 2.5-day training course called Preventive Controls for Qualified Individuals. And of course, there's an acronym. So PCQI is the acronym for that course. That course really focuses on subparts C and G, and these are that most labor-intensive, most document-requiring parts of the rule. They include requirements for a written hazard analysis and, as relevant, different preventive control programs and associated documentation. So if you're eligible for these size-based exemptions, which you are if you sell less than $1 million of product each year, these are the elements that you are exempt from. But you are still subject to all the other subparts of the rule. And these remaining subparts really focus on good manufacturing practices and required documentation. And so that's what I'm going to focus on here, because there really isn't another course for small food processors that addresses this other type of PC rule requirements. So a big part of this is going to be that subpart B, the good manufacturing practices, or GMPs for short, that we've talked about too a couple times already. These apply to everybody, including small facilities who produce FDA regulated foods. This part of the regulation lists really basic sanitary practices required in food production. You should consider it a baseline, right? A minimum, and it's a foundation for your food safety program. And for small food businesses in particular, you rely on a strong GMP program to help manage your food safety risks. And I'll also note GMPs are places where you can enhance your baseline employee health and hygiene activities, again, to help mitigate that spread of COVID-19 within your production environment. So before we get into the regulation and some additional COVID-19 practices, I just want to touch on some of the words or additional definitions that I've kind of been providing here. So oftentimes you hear the term food safety thrown around. Food safety refers to a set of programs or activities that you perform within your business to prevent illness or injury to consumers who might be eating your product. Hazards are things that cause the illness or injury, like a foodborne virus or a bacterial pathogen that causes illness. And risk is the likelihood of illness or injury occurring. So to put it together, by implementing a strong food safety program, you reduce the risk of different hazards harming your consumers. There are often misconceptions about the impact of foodborne disease in the US population. And despite having a very robust food safety system in the US, we nonetheless still have an estimated 1 in 6 people who contract a foodborne illness each year, equals out to something like 3,000 deaths and 128,000 hospitalizations. Although I think most people who've had food poisoning before know that most cases are mild, though they still have significant economic burden resulting from lost work days and recalled product. And some small processors too can be the cause of foodborne disease in the absence of appropriate food safety programs. So it's not just large businesses here who are responsible for ensuring the safety of our food system. In the case of COVID-19 preparedness too, I think it's useful to think through risk and hazards. So you can integrate different activities into your food business just by flipping the script kind of on thinking through what type of hazard exists and how you're going to control it. So in that case, the hazard would be SARS-CoV-2, and you would control it through a variety of different kind of GMP type programs to reduce the spread. Some will maybe align with programs you already have in place. Others will be different, and you might need to modify your programs to accommodate this kind of novel hazard. So in food safety programs, you often hear about people talking of 3 different types of hazards: biological, chemical, and physical. Biological hazards include foodborne pathogens like E. coli, Salmonella, Listeria, Clostridium botulinum, especially for those canned products we were mentioning. Chemical hazards include allergens, primarily, and physical hazards include things like broken glass or metal fragments that can be introduced into product during production. So if you are a facility subject to all parts of the PC rule, then you have to document and develop a written food safety plan that you identify hazards that can occur at each step in production as a part of developing that food safety plan. Smaller facilities, again, are going to leverage and rely on their GMP programs to help mitigate risk from all of these hazards. There's 8 key components to GMPs. And if it feels like now we are talking about subparts of rules here, we are. But these activities are organized by categories of actions necessary to support food safety. So when you think about training for yourself or for others who you work with who are food handlers, it should cover kind of generally these 8 topics with a different emphasis depending on job-specific responsibilities. The best way to learn about GMPs is from kind of case examples or from hands-on training. And so some additional resources you might find useful, I'll kind of reference again at the end, and then I think some of my state-specific hosts here might also have suggestions as well that they can share too. All right, a key component of GMPs relates to personnel. And so that specifically refers to employee health and hygiene. This includes things like restricting personnel with symptoms of foodborne illness like vomiting or diarrhea from working in a food handling space. It includes practices around hand hygiene. We'll talk about too, how and when to wash hands, glove usage, where employees can eat, drink, or smoke. And it includes aspects related to personal grooming, hair restraints, jewelry removal, and so on. This is a big focus of food handler GMP training, as you can see, because kind of regardless of what an individual's responsibilities are in the business, these are going to apply, these general kind of principles governing employee behavior. And GMPs here might be a place to consider enhancing your bare minimum of policies to include social distancing, or additionally excluding sick employees with symptoms from COVID-19. So those are going to be more likely to be respiratory symptoms, and expanding hand hygiene to prevent the spread of SARS-CoV-2. So I'm going to make a few recommendations here about practices to prevent coronavirus spread. But I want to be clear that just because in things like sanitation, you wash down all the surfaces and all the door handles and you're really diligent about that deep cleaning, that unfortunately is not going to be a substitution for social distancing and things that promote social distancing like mask wearing, which is hard to implement, but crucially important to the mitigation of spread, because people are both the kind of vector and reservoir for virus, meaning even if you clean every surface really well, one employee could still get sick from another employee if they're in close proximity, even if all the surfaces around them are clean. So an analogy that I've heard that each of these kind of mitigation methods are like a slice of Swiss cheese. So they help some, but they have holes. But if you pile slice after slice of Swiss cheese on top of one another, you start to cover up all the holes. So that's why it's useful to kind of have a robust plan in addressing COVID-19 spread. One useful mitigation method that also is aligned with GMPs is hand hygiene. So hand hygiene as a topic includes hand washing with soap and water, hand sanitizing with ethanol-based sanitizer, and glove usage. And collectively, right, that kind of helps prevent the spread of virus between people and from the environment to people. A note about glove usage. So it does not replace the importance of hand washing. And if you do it incorrectly, it could actually be worse than no gloves at all. So that's because people who wear gloves sometimes think that their hands are going to be sterile, but as you go around touching things, the gloves themselves become contaminated too. So if you're going to implement glove usage, developing a policy on when you use gloves and when you change gloves is going to be important. Kind of similarly, a note about hand sanitizing. So you might have previously heard in a training such as this that hand sanitizer isn't effective against foodborne viruses and shouldn't be used instead of hand washing with soap and water. And that might be confusing to you now, given the massive demand for hand sanitizer during the pandemic. And it's true that some viruses like norovirus that are foodborne aren't sensitive to hand sanitizer, which is where that recommendation and compliance with GMP comes from. But SARS-CoV-2, the virus that causes COVID-19, is structurally different. It's surrounded by a lipid envelope. It's really sensitive to ethanol, as well as soap. So hand sanitizers are likely to be effective risk reduction strategies in that case, and especially if you are in an environment that doesn't have access to running water. So I guess the takeaway there is, from a food safety perspective, it doesn't replace soap and water, but it might be useful for you from a SARS-CoV-2 prevention perspective. Although I'll also note that sanitizers, if you have dirty or oily hands, in those cases, you're really going to want soap and water. Sanitizer won't be effective there either. The second component has to do of GMP. So now we're kind of moving back up to that higher level of the 8 pillars of GMPs. And the second component has to do with plant and ground maintenance. And so this includes making sure that the land immediately surrounding the building is well drained and free of debris. It's not going to be a point of pest harborage. Inside the facility, you want to have adequate lighting and have guards against glass breakage. So commonly it's using shatterproof glass. The space and equipment also has to be cleanable, and appropriate routes for waste disposal need to be in place. So if you have a surface there that's difficult to clean, that doesn't meet that requirement of GMPs. By contrast to this last topic, I think you can see how kind of the basic practices of personnel are more aligned with those components. And these, while important and a part of GMPs, not necessarily are topics that you emphasize to all employees all the time or part of refresher training. So there's some variation there. A third component is sanitary operations. So this includes having appropriate sanitation programs in place, but also ensuring that the sanitation programs themselves don't introduce additional hazards. So that's accomplished by selecting, number one, selecting cleaning chemicals that are appropriate for their use. So if they are labeled for not to be used on food contact surfaces, you should not use them on food contact surfaces. If they require an additional rinse down step, that you're doing the additional rinse down step. And properly labeling cleaning chemicals if you receive them in bulk and put them into smaller containers. A fourth component is equipment and utensils. So similarly, it specifies that equipment, utensils, disposable items have to be protected from potential routes of contamination. Sanitary facilities and controls dictate that there's adequate potable water, plumbing and sewage disposal, including access to toilet facilities and hand washing stations is available, and that they're stocked and sanitary. So in these kind of series of examples, you can see two ways that you might expand them to prevent the spread of COVID-19. So for example, maybe your current sanitation program really focuses on equipment and food contact surfaces, but now you might also focus somewhat on high touch surfaces and personal spaces like door handles, refrigerated handles, and desks for increased sanitation frequency. So if you're curious about whether or not your sanitizer is effective against coronavirus, you can check it against EPA List N, N as in Nancy sanitizer. While these sanitizers haven't been tested specifically against SARS-CoV-2, they have demonstrated to be effective against harder to kill viruses. So that's where that list comes from. And if you want to verify your sanitizers are on List N, this is how you do it. So all you do is you look for that EPA registration number that is listed on the side of the container, and then you Google EPA List N sanitizers, and you match it up. You see if that EPA number is listed on List N. You'll have access again to the recording of these slides as well for reference in the future. And if you work with a chemical supplier, they can probably also help you answer that question. All right, back to another category of GMPs. So under process and controls, products have to comply with FDA minimum requirements for default action levels, and products must be stored and handled to prevent contamination and deterioration. So this often has to do with a focus on commodities and ensuring limited mold contamination or pest activity. This may also include preventing microbial growth through different processing activities like cooking, refrigeration, adjusting the product's pH or water activity. That really is product specific and varies. And then allergens are managed as well to protect consumers from cross-contamination. And, you know, if you are already operating a food facility that receives inspection from FDA or from state inspectors, you likely already have GMPs in place. So how do these updated GMPs and the PC rule really differ? One key area that they do differ is in the new emphasis on allergen management. So allergens are controlled through, number one, labeling. So including a declaration statement on products when you have allergens as an ingredient. And then number two, they're controlled through sanitation. So preventing allergen cross contact between runs with allergen that contained is in one product and another product that's run on the same equipment that doesn't have that same allergen. So sanitation controls cross contact there. Other practices to have in place to prevent allergen cross contact include thinking about how you receive and store allergens, noting, you know, what ingredients you handle that contain allergens, segregating allergenic ingredients in storage, and marking allergen containing ingredients very clearly for you and your employees. So this is particularly important, I think, if you operate out of a shared use kitchen or a commissary or an incubator or something like that, because you might need to have a conversation with the manager or other people who use your space, because it's not just on you alone in those cases to make sure that you have programs in place to control allergen cross contact. Okay, so before leaving GMPs, I'm gonna touch on just briefly kind of a final point about COVID-19 mitigation practices that I think is super important, but doesn't necessarily align with what you're already doing for GMPs. So as I kind of mentioned, the most common way for COVID-19 to spread is through person-to-person transmission. This is what I mean when I said that, you know, even if you clean every surface really well, you still might not be controlling COVID-19 as well as you think you are if you have employees in close proximity to one another. So wearing face masks, keeping separated from one another by at least 6 feet. And it's increasingly recognized that improving or increasing ventilation through fans or open windows or reducing recirculation of air conditioning or doing things outside when the weather allows is also useful in diluting virus in the air or in droplets. So these practices are difficult to implement. Like, I want to acknowledge, I get the food industry is burdened by that, but it could include things like reducing operational capacity or having people come in on different shifts. But again, preventing person-to-person spread is going to be the most important thing you can do. And you might, consider other things like policies around testing or health screening, asking each employee each day if they have symptoms or if they've been around someone who tests positive. For me to come in to work at the university, I have to do this too. But recognize that even people who don't have symptoms can spread virus before those symptoms emerge. So those aren't foolproof steps. And so if you take one thing away from kind of all of these little COVID-19 gems that I've hidden in the presentation, it's that kind of a good plan to mitigate COVID-19 in your food business is going to be one that assumes people in your facility already have it, and that you're relying on the policies you have in place to prevent the spread. And so mandatory mask usage as well as spacing people out, like I mentioned, are going to be really important in that regard. And another thing I just want to make mention of here is that the guidance and practices that people suggest on preventing COVID-19 spread are evolving. And so the messaging we had even a few months ago might not be as good as the best practices that people talk about now. So looking at this infographic, it came from CDC. You can see that some of the suggestions here are these setting up barriers, like this plexiglass partition that might be an effective risk mitigation step. I would suggest that more current thinking is that viral particles can travel around that plastic barrier, which is to say that that is not necessarily an equivalent risk mitigation strategy to face masks and distance and ventilation. Okay. So we're moving actually out of GMPs now, so if you can believe it. So now we are going to be talking about additional modified requirements of that PC rule of FSMA. So you're definitely expected to comply with those subparts that we discussed, including GMPs, but you also are expected to train and document training for employees on several of those components. So here's an excerpt from the regulation. You can see this is from subpart A now, and I want to highlight a few parts that answer the question, who has to be trained and what must they be trained in? So this first question is who. So who within the food industry do you need to train in your business? Is it every single employee? Not necessarily, but it could be a lot of them. So it's important that everyone who has responsibilities in manufacturing, processing, packing, and holding food receives training. You can see I highlighted this in red. So if you hire a summer intern to run your Facebook page, they might not have responsibilities in those areas, but do think broadly about who this could include. So for example, if you make or if you have someone who prints labels or someone who does ordering or receiving of ingredients, that person could have a role in allergen management. So they should probably receive some training then on food safety. The second part I have highlighted here is the what. So what do they have to receive training in? And that is the principles of food hygiene and food safety, such as employee health and personal hygiene, which is basically the GMPs, if you kind of remember that, with a special emphasis on that personnel component as well. What this doesn't answer is how often you have to retrain people. This figure is a survey of food processors asking managers how often they offered retraining to employees, and we organized their responses by the size of the facility. So you can see the largest facility, those with 30 or more employees, most commonly offered retraining every year, while the smallest facilities most commonly didn't offer retraining at all. So according to like the bare minimum regulation, you do not have to offer retraining. But as a rule of thumb, let me suggest the following. So you should offer retraining if an employee's responsibilities change. So if they change kind of job tasks, like you give them a different job. You should retrain if you identify a problem that could be fixed by retraining. So if you see a bunch of labels misapplied, probably time to retrain on that aspect and talk about the importance of allergen declaration statements. or finally, at a minimum once a year. So this would be my kind of best practice recommendation to you. At minimum, a very brief refresher training once a year is a good policy. Where are sources of GMP training? So if you or someone who works in your facility possess the skills to offer a decent GMP training, that's potentially some of the best real world examples for your employees to get. There are also resources through University Extension. This class is kind of part of professional development and training, and there's other online resources as well. So here's a link to one of them. This is an online GMP course that was commissioned by the FDA, and it's hosted by Cornell. There might be others that our host can discuss for in-state resources at the end too. And you can see there's kind of different modules that align with the different subsections of GMPs. You can go and you can come back to it. That's at least one advantage of these kind of online courses. Okay, so I'll wrap up this section by saying that there are requirements for documentation for training. So we established in the talk about this regulation that people engaged in manufacturing, packing, holding of food have to receive training in food hygiene and food safety, including the importance of employee health and hygiene. But note, I want to point out that this does not say that they are qualified through experience. So that's language that's sometimes used that's not used here. It means they have to be trained, and that training has to be documented. So this might be a little different than what you've been previously doing. But when we talk about record keeping to support training, it does not need to be anything fancy. At the top of the record, you include the name of the record, employee training log, and maybe the name of the company. Then provide a list of employee names, and beside each employee list the date they were trained, what they were trained on, signature initials of supervisor. That's a sufficient employee training log. And it could look like this, just as described. I made this in Word. It took 5 minutes, but there's no specified format. Like, you're welcome to adapt this if you like, but you don't have to. You can develop your own. You don't have to have a certificate from a training program. You could include a certificate if you get one as part of your supporting documentation. And if you develop a log like this, again, listing kind of webinars or these professional development experiences like this can also be included on your employee training log too. Okay, so zooming back out to this higher view of the regulation, we've talked about some portions of what small food businesses are or are not subject to, which I'll wrap up kind of next with additional documentation requirements to support your qualified exemption, and what you kind of need to demonstrate that you are not subject to all aspects of these rules. So getting into documentation of that qualified exemption from the PC rule, I guess I first want to put out there this caveat that even if you are exempt from some parts of these rules, obviously no facility is exempt from the responsibility to produce safe food. But based on the size of production, there are some scale-sensitive approaches to this rule that were set forth in the form of these modified requirements for very small food businesses. So these very small food businesses are subject to these modified requirements, but in order to be eligible or to get that modified exemption, you do need to submit a form to FDA attesting to your status as a qualified facility. So that's how you establish your exemption. So theoretically, if you do not complete this attestation form, you would be subject to the full PC inspection. And I've heard different things from different state or federal regulators on this, but I think regardless, it is a good idea if you are eligible for this exemption to go ahead and get that attestation form completed. As mentioned, this very small food business status is attached to facilities that make less than $1 million a year in food on average. There's also this alternative metric that is very uncommonly used that has to do with annual gross sales and the amount to qualified end users. I'm not going to get into it, but it's for facilities that have kind of high value product that they don't sell or that they require to hold and age for a long time. So very unusual. You should probably focus on the $1 million a year number. The components of the rule that qualified facilities are still subject to include general provisions, GMPs, those modified requirements, which include certain record keeping requirements, and the rule elements pertaining to withdrawal of these modified requirements. So we've already talked through a lot of these. We're just going to bring it home by finishing what we have left to cover. And we're going to review that attestation form, which qualified exempt facilities must submit. So facilities eligible for this exemption may either voluntarily comply with subpart C and G, again, those very labor-intensive document requiring components, or they can choose to otherwise comply with applicable state food safety regulations. And choosing between these two is actually a question on the form. This is why I bring it up, because generally it's not obvious when you go to submit the form, that's what they're asking you. But generally, you're going to want to choose the option to comply with other applicable state food safety regulations. And you might be asking yourself, do I need to complete this form, right? Am I subject to the rule to begin with? And there are certain businesses that do not complete the attestation form. Farms, food service groups like restaurants, or primarily food retail establishments like grocery store. I mentioned wineries and breweries as well at the start. But one indication that you do file is if you BT register, meaning you have a bioterrorism number on file with the FDA, which is the practice that was in place. It predates this rule. It started, I think, after 2001. You might not necessarily remember your number, but theoretically, this was done when you started your business. The website listed here takes you to this FDA homepage for the FDA industry systems, where you can get either both your BT registration number processed using this form FDA 3537, and where you can complete your qualified facility attestation form. That is FDA form 3942A. This is what 3942A looks like. We're going to quickly walk through each section of the form so you are familiar with it. When you go to submit it, you'll know exactly what the questions are asking you. This is just the first section. It's really contact information, and you'll note here it does ask for that facility registration number. The next section asks what type of notification this is. So whether it's your first time completing the form, or if you're renewing the attestation, as you are required to do every 2 years, or if you're notifying the FDA of a status change. So for example, if you start selling over $1 million of product, you're no longer eligible for that qualified exemption. You check this third box, and then you skip all the rest of the form to the very bottom, and we'll come back to that here at the end. So next, the form asks whether or not you are a qualified facility under at least one of those 2 metrics I mentioned before. If you made less than $1 million of food on average a year, you check that first box. The next section is a question about compliance. So are you going to voluntarily comply with subpart C and G, the first option, or will you simply comply with other applicable state food safety regulations? Again, most very small food businesses are going to check that second box. And then finally, you just attest that what information you've provided here is true. And this needs to be completed by the owner, operator, agent in charge, meaning so technically not every employee in your facility can be filling this out. It has to be the responsible person, the owner, operator, agent in charge. You are definitely responsible for determining your status as a qualified facility and completing this form. FDA is not going to go ahead and do that on your behalf. But FDA may verify your determination is correct. And I like to think of it like taxes. So you are responsible for filing your own taxes and figuring out how much money you owe, but the IRS can verify that your documentation or your determination is correct. So it kind of works the same way here, and the responsibility is yours to complete this form. FDA can also withdraw your qualified exemption status under very broad certain circumstances. So if a foodborne illness is linked to your facility, or if it becomes apparent that you're imminently about to cause an outbreak of foodborne disease, they can withdraw these modified requirements. And in these example scenarios, FDA can kind of pull those exemptions back in. So you file the form every 2 years. You saw that biennial renewal box that you could check when you resubmit this form. But you should do the calculation every year to ensure that you are still eligible for this qualified exemption. And I'm going to spend just a second walking through that calculation about how to do it to ensure that you produce under $1 million a year. It sounds simple, but of course there's all this nuance into what counts and what doesn't, and how you actually do that calculation. So you need to calculate the total value of food produced, and you include all food, regardless of whether the human food is subject to this PC rule or not. So for example, you would include products such as seafood and juice and the low acid canned foods and even dietary supplements, even though they're not subject to the PC rule. And then similarly, you would include raw ag commodities like produce or grains or milk and eggs, and products subject to jurisdiction under USDA, things like meat produced for human consumption. So regardless of if it's subject to that PC rule, it is included, and it also includes the total value of food produced. So it's not just sales. If you produce it and you have it on hand in storage prior to sale, the value of that food also goes to that $1 million. And that $1 million is an average of the 3 previous years of production. So to do your calculation, you first determine, which 3 years to include. Then you determine the value of all food produced in each of those years, adjust for inflation, and then you calculate the inflation adjusted sales average. So to walk through that, first, what 3 years do you include? So that average is based on the 3 previous years, not including the current year. So if it's currently 2020, the 3 previous years would be 2019, 2018, and 2017. If you don't have 3 previous years of records, you have some options. So you could rely on 1 or 2 years to provide that estimated revenue, or you could provide projections. But again, the credibility of those projections are going to be subject to FDA evaluation. If you have 50 employees and you say you're making less than $1 million a year, they might have some follow-up questions for you regarding records. The next step or the next issue has to do with adjusting for inflation. So FSMA was passed in 2011, so it is $1 million in 2011 dollars. And you can adjust your sales value for inflation using this process. You just Google U.S. Bureau of Economic Analysis implicit price deflators for gross domestic product. Again, you can look this up from the slides later, but go to that website and you identify index numbers by year. And so you'll need the index number for whatever current year that you're working on, and the 2011 index number as well. So once you have all those numbers of the value of product produced in that year, the index number for that year, and the index number for 2011, all you have to do is multiply the value of that food product by the 2011 index number, and then you divide by the index number for the year for that value of product. And so that answer is the inflation adjusted value of product. So in some of these food chains are complicated. And so in some of these cases, let's say you are a very small food business, but you are selling ingredients to a larger food business, one who is not eligible for these size-based qualified exemptions. So those facilities are subject to subpart C and G of the rule, and that includes a supply chain applied preventive control. So they might come to you and ask for certain documentation to demonstrate that you are controlling hazards that they rely on you to control. So if you're asked to provide evidence, what you can provide them according to the rule is a written assurance of your status as a qualified facility and your compliance with other applicable state regulations. Okay, so there are several exemptions from subpart C and G that exist for certain types of businesses. I mentioned that farms don't submit attestation forms. Producers of alcoholic beverages, again, the wineries and the breweries, primarily retail or food service operations, and nonprofits are exempt from subpart C and G of these written PC rules and don't have to submit the attestation form by virtue of what they are. Okay, so just to touch briefly on what other documentation you need to have, you're going to want to keep on hand the documentation that supports or substantiates statements you made in the attestation forms. So in general, records have to follow the general record keeping requirements in that they're accurate and legible. You want to keep them on hand for at least 2 years. And example records that you might want to consider maintaining are various financial records, taxes or bills of lading to support the claim that you produced less than $1 million of food in each year, as well as documents that show, for example, your training and compliance with other applicable parts of that regulation. And oftentimes state inspectors ask me to mention this, but I want to point out, you should not expect inspectors to come charging into your facility and ask for all of your financial documentation. It's very unlikely that they would ask for those records, except in the case where they need to verify the credibility of some of your statement. Nonetheless, because they go to your substantiation, you should keep track of those records just in case. You should also keep kind of similarly records of calculations of annual sales and inflation adjustments that we just walked through, since again, those go towards claims you made in your 3942A statement. These records are subject, again, all of these kind of components are under subpart F of that preventive controls rule, and you would need to be able to produce them if you were requested them by the FDA. Okay, so if your status changes, I talked about that at the beginning, you fill out that third box that says this is a status change, like you started making over $1 million of product each year, then you complete this final section called status change. You just check the box that your facility is no longer eligible for these qualified requirements. And I just want to give you a bit of perspective on what would happen under that status change. It changes a lot, right? So it changes quite a bit in terms of your requirements for development of a written plan and its implementation, and even some training. So it would be well advised that you do not wait until you're really close to crossing over the $1 million threshold for the average of 3 years of sales to find out, surprise, you need to get all of this other programming up and running in your facility. So if you are approaching that $1 million number, it is judicious to get things in place kind of well before you cross that line. And a good starting place would be to take that 2.5-day PCQI course, the Preventive Controls for Qualified Individuals course I mentioned before. So just to summarize, for small food businesses, you are required to have documentation for training and for your qualified exemptions. I'd also strongly suggest you document critical food safety factors. So critical activities are those which are used to kill bacterial pathogens like a cook step, or stop bacterial growth like refrigeration or acidification. So very much depends on the individual product. But sanitation and labeling as well, things that control allergens or cross-contact of environmental pathogens would fall on this list of very important critical functions as well. And so you should think through what activities in your production system are really important too for food safety, considering different documentation strategies so that you can monitor their completion as well. And I'll just note here that for small facilities, a simple make sheet or a batch sheet that lists cook temperatures and times, the date product was produced, the labels or lot numbers of ingredients used for traceability, and other critical factors like if you do a visual inspection of cleanliness or you check to make sure that allergen declaration is in place for each lot, that can be very helpful in supporting your food safety system. So it's simple, but useful to implement some better record keeping over time. And there are additional templates for kind of monitoring these critical food safety activities. We have them available on the Cornell Dairy Foods Extension webpage. They're not dairy specific, they're easily adaptable. And there's others available too. So that is it for me today. Thank you again for your participation. I'm gonna turn it back over to Angela, I believe, to wrap up this section.
Thank you, Abby. And Abby, if you could drop in the chat the address to those templates on the Cornell Dairy Food Safety webpage, that would be very helpful.
Yeah.
So if you have any questions, there was a lot of content in this presentation. Thank you, Abby. Food safety documentation is a lot for food businesses. And so we are recording this. If you need to refer back to certain sections, it will be on our webpage. If not today, early next week. And we will send a follow-up email to all of our participants with that link. So if you have any questions, please put them in the Q&A box at the bottom. So Abby, I'll just throw this question at you. You had mentioned that for qualified attestation form that farms do not need to fill that out. I think I had some confusion with that. So if I was a farm and I had a commercial facility and I was making commercial jams, would I need to fill out that qualified attestation form?
Yeah, so mixed type facilities may need to fill out the form, but if you are only a farmer, like you're only subject to the produce safety rule, then you don't complete the attestation form. You're not under this PC rule compliance.
Thank you. Thank you. Let's see. I don't see any questions coming up. And it looks like we have about 2 minutes left. Drs. Perez and Dr. Mrowicki, do y'all have any questions for Abby?
You know, in looking into the regulation, there seems to be a little bit of it's not very clear on some of the more alternative new types of facilities. So food hubs that operate as just packing sheds that may do some kind of fresh cut. I know there is a fresh cut regulation, but then if it's going to be a mixed type facility where they're going to be doing food processing for other people, and the actual food hub is not the entity that's doing the manufacturing. We've tried to get some clarification on that, and if you have any insight on how those operations should be applying the rule.
Yeah, so I will tell you what I have been told, with the caveat that continue to ask questions and get follow-up from other regulators on this too. But my understanding is that in these kind of operations where maybe there's an entity that owns the space and then there's individual groups that use the space to do processing, it's the individuals that do the processing in there that need to complete this attestation form, and each of them do, and not the owners of the space itself. So that is my current understanding, although I think you're right, there's a lot of gray area, as there's a lot of kind of complex examples of incubators, food hubs, commissaries that do that kind of work.
Yeah, well, thank you for that clarification. I'm in agreement with that interpretation so far. So.
Thank you. Well, it looks like we just hit the 1 o'clock hour, and I do not see any additional questions. So I wanted to thank our speaker today, Dr. Abby Snyder, for joining us and hosting all this wonderful content. And thank you to Dr. Morwicki and Dr. Perez for sitting in as well. Thank you again, and have a wonderful day.
Thank you, Angela. Thank you, Dr. Snyder.